Every 40 seconds, somewhere on this planet, someone has a stroke. By the time you finished reading that sentence, another brain was hit. Every year, stroke kills almost 6 million people worldwide. It's the second leading cause of death. And it's the number one reason people wake up unable to speak, unable to move their arm, dependent on others for the rest of their lives. But here's the part almost nobody tells you clearly enough. In most cases, the brain warns you. Hours before. Sometimes a full day before. It sends very specific signals. Signals that seem small, that fade on their own, and that most people write off as fatigue, low blood pressure, or I must have slept on my arm wrong. That dismissal can cost everything. In this video, you're going to learn to recognize those signals, what they actually mean, and what to do in the next 72 hours if any of them show up. Stay until the end, because the fifth warning sign is the one that surprises people most. And there's a specific combination that neurologists treat like a fire alarm. An ischemic stroke, responsible for about 85% of all cases, rarely comes out of nowhere. For a brain artery to suddenly get blocked, the groundwork usually took years. The vessel walls have been damaged. Cholesterol and clots have been building up. The opening has been slowly narrowing. This isn't an explosion out of nowhere. It's the final step of a long process. And along that road, your body usually sends out warning signals. The problem is nobody ever taught you how to read them. Think about it this way. Your brain weighs roughly 3 pounds, about 2% of your body weight, but it uses around 20% of all the oxygen you breathe, and about 25% of all the glucose circulating in your blood. It's a control center that never turns off. And it needs a constant fuel line. Cut that fuel for even a few minutes, and cells start dying in ways that can't be reversed. That's why doctors say stroke is a race against time. Literally a race to save brain tissue before it's gone for good. Now, here's the part most people miss. In medicine, those early warning shots have a name. They're called transient ischemic attacks, or TIAs. Transient just means temporary. It comes and it goes. Picture a carotid artery, the main neck artery that carries blood from your heart up to your brain. Over years, a fatty plaque forms on the inner wall right where the artery branches. The opening slowly narrows. And at some point, that already tight vessel goes into a brief spasm. Blood flow stops for a few seconds or a few minutes. The brain area fed by that artery basically blacks out for that short window. You feel or see a stroke symptom. Then the spasm relaxes, blood flow returns, the symptom fades, and you think you're fine. Here's what research actually shows. A TIA very often comes right before a major ischemic stroke, typically within the next 72 hours. Those 3 days are your window. The moment when the disaster can still be prevented. Most people don't use that window because the episode was short, strange, and then went away. So they talk themselves out of taking it seriously. These episodes usually last from about half a minute to maybe 10 minutes. That's exactly why they slip through the cracks. But each of those episodes is your brain sending a final, very clear message: I am about to be in serious trouble. Let me walk you through the 5 big red flags, not just what they look like, but what's actually happening inside your body each time. And pay close attention to number 5. That's the one that catches most people off guard. You get up, walk toward the kitchen, and suddenly one eye goes dark or foggy, like someone pulled down a black curtain over that eye, or smeared the lens with gray mud. You blink a few times, maybe rub the eye. Within seconds or a minute at most, your vision comes back. So you blame it on standing up too fast or too much screen time. Here's what actually happened. That curtain was almost always a tiny clot or a small fragment of plaque that broke off from the wall of your carotid artery, traveled up, and briefly plugged the artery that feeds the eye. The artery to your eye isn't some random isolated tube. It's a direct branch of the inner carotid artery, the same one that feeds your brain. When that clot lodges in the tiny eye artery, the retina loses its blood supply for a moment. You see darkness instead of a clear image. When the clot drifts away and blood flow restarts, vision comes back. And you feel lucky. You were lucky, because that exact same clot could have gone 2 millimeters to the side, into a brain artery. And then instead of a 1-minute blackout in one eye, you're looking at permanent loss of speech, paralysis of an arm and leg, or death. Doctors have a classic Latin name for that one-eye blackout: amaurosis fugax, literally, fleeting blindness. Neurologists treat that phrase like a fire alarm. If a patient describes that episode, they get urgent evaluation because the risk of a real stroke in the next hours is high. Don't brush off darkness in one eye just because it passed quickly. Numbness or tingling on your left or right side, but not both sides at once. It might be the whole arm, just the hand, half the face, or even one full side of the body. It feels like pins and needles, like cotton, or like that body part has turned into rubber. And it comes out of nowhere while you're just sitting, walking, or talking. Lasts a few minutes. then goes away on its own. You've probably slept on your arm before. The tingling that clears up when you shift position, that's different. There, the problem is a compressed nerve, not the brain. With a TIA, the problem isn't in the arm, it's in the brain area that maps sensation from that arm. And the episode has nothing to do with posture. One more thing worth knowing. Stroke symptoms are usually one-sided because each brain hemisphere controls and feels the opposite side of your body. When both hands go numb evenly at the same time, that more often points to a neck or spine issue. But sudden one-sided numbness that resolves after a few minutes, that's a strong reason to get checked for TIA and stroke risk. Next sign, and this one surprises a lot of people because it looks like something completely different. You're on a flat, familiar surface. Out of nowhere your foot lands in the wrong place. Your leg feels weak or rubbery. You stagger into the wall for a second. Or you get hit by a sudden violent spinning sensation that makes you grab a chair or the door frame. Even though you weren't spinning, you didn't jerk your head, and you didn't just stand up from bed. The part of your brain that keeps you balanced and coordinates smooth movement is called the cerebellum. It sits low in the back of your skull, like a small extra brain. It constantly calculates where your body is in space, and how hard each muscle should fire so you walk straight instead of zigzagging. The cerebellum gets its blood supply from arteries that run up through the bones of your neck into the back of your head, what doctors call the vertebrobasilar system. If blood flow in those arteries drops sharply, even for a few seconds, the cerebellum essentially glitches. That's when you suddenly veer sideways, misstep, or feel violent dizziness for no obvious reason. In clinical practice, there's a pattern. People write off these episodes as bad shoes, I was tired, or must be my blood pressure, and only find out later those were cerebellar transient attacks. Benign dizziness usually has a clear trigger. Rolling over in bed, turning your head quickly, a known inner ear condition. But spontaneous intense dizziness plus any trouble walking straight should be treated as a possible TIA until a doctor rules out a vascular cause. Before we go further, let me be real with you about something. If you occasionally can't remember your neighbor's name, or you temporarily blank on the word for toothbrush, that's not a stroke sign. That's a normal tip of the tongue moment that happens more when you're tired or stressed. What worries neurologists is something quite different. It's when your speech suddenly breaks down so badly that even you feel something is seriously wrong. In most people's brains, there are two main speech areas, both usually in the left hemisphere. One area helps you form words and send clear instructions to the muscles of your tongue, lips, and jaw. When that region loses blood flow, you may understand everything people say. You know exactly what you want to answer, but you can't get the words out. They come out slurred, chopped, or stuck. The other area helps you understand speech and organize your own sentences so they make sense. When that zone is in trouble, a person may speak fluently, but say complete nonsense, like word salad, and may not understand simple phrases directed at them. If any of those speech problems show up suddenly, and then fade after a few minutes, that's classic for a TIA. Not I was just tired. You can't ignore broken speech just because it's self-corrected. That's like your home alarm going off, stopping on its own, and you deciding it was probably nothing. This is the one that surprises most people, and it's the one that closes the loop we opened at the very beginning. The skin condition is vitiligo, patches of pale or completely white skin where pigment-producing cells have stopped working. Vitiligo is an autoimmune process, meaning the immune system starts attacking your own pigment cells as if they were foreign. And honestly, when your immune system goes off target like that, it often doesn't stop at one organ. In many people, that same autoimmune process can quietly inflame the inner lining of blood vessels, the endothelium. The endothelium is a microscopically thin layer of cells that coats the inside of every artery like a super smooth non-stick surface. When it's healthy, blood components glide by and nothing really sticks. When it's damaged by inflammation, it becomes rough and scarred, and things start to cling. Cholesterol, platelets, inflammatory proteins, the seeds of plaques and clots that build over time. Vitiligo alone doesn't doom you to a stroke, but if on top of that you develop frequent, unusually intense headaches that don't fit your usual pattern, that combination deserves a proper vascular workup, not a wait-and-see approach. Headaches in general are tricky. A very common cause of daily or frequent head pain is wear and tear in the small joints between the second and third neck vertebrae, basically arthritis in the neck. That joint degeneration can irritate nearby nerves and send pain up into the head, and it has nothing to do with a blocked brain artery. And a lot of people carry an undiagnosed neck disc herniation without knowing it. Headaches shouldn't just be numbed with pills long term. They need to be decoded with a doctor, especially when they change in character or pair up with other warning signs like the ones we just covered. Here's the point most people get wrong, and this closes that question we left open at the start of the video. The big myth. My cholesterol is normal, so I'm safe from stroke. Stroke risk isn't just about what's floating in your blood. It's very much about the condition of that endothelial lining on the inside of your vessels. Think back to that nonstick pan idea. While the coating is intact, food doesn't cling. Once you scratch and damage it, everything starts sticking and burning. The first major enemy of the endothelium is chronically high blood sugar. Glucose is your cell's fuel. But to get from the blood into endothelial cells, it needs insulin, the hormone that basically opens the door. When your body doesn't make enough insulin, or your cells become resistant to it, you can have plenty of sugar in your blood while the vessel lining cells are still starving. Starving cells get damaged, lose their shape, and can even peel off the inner surface, leaving behind rough, scar-like patches. Those scarred zones can't contract and relax properly when your blood pressure changes, and they become perfect landing pads for LDL cholesterol, platelets, and other blood components. Over time, those deposits grow into the plaques that narrow and stiffen your arteries. And this process starts years before anyone officially tells you that you have diabetes. Even mild prediabetes, where your glucose is only slightly above normal, is enough to injure the endothelium quietly for a long time. The second big vascular enemy is smoking. Cigarette smoke contains thousands of chemicals, and dozens of them cause direct damage and inflammation to the endothelium. At the same time, nicotine and carbon monoxide make your blood thicker and stickier, increasing how easily platelets clump and how readily clots form. When you put a damaged, inflamed vessel wall together with thick, sticky blood, you've created ideal conditions for a clot to plug a brain artery. That's why smokers have roughly 2 to 4 times the risk of ischemic stroke compared to non-smokers with similar cholesterol and blood pressure numbers. And blood pressure, here's a twist most people don't see coming. Chronically high blood pressure, yes, is one of the strongest risk factors for stroke. It physically stresses and weakens vessel walls over years, speeds up plaque formation, and is the main driver behind hemorrhagic strokes where a vessel literally bursts. But here's the thing most people miss. An ischemic stroke often happens not at the peak of high blood pressure, but at a relative low point. Picture a brain artery already narrowed by more than half because of a plaque. It's like a water pipe that someone has squeezed in the middle. As long as the pressure in the system is high enough, some water still squeezes through. But if the overall pressure falls, the flow through that narrowed point can drop to almost zero, especially if a small clot gets stuck there. At night while you sleep, blood pressure naturally falls by roughly 15 to 20%. That's normal physiology, not a disease. But if you already have a plaque-narrowed artery, that nighttime drop can be enough to turn a partial blockage into a full stop. That's one reason some people go to bed feeling fine and wake up with stroke symptoms, or someone finds them that way in the morning. So, stroke isn't a lightning bolt from a clear sky. It's a predictable event that almost always follows years of silent vessel damage, and it often announces itself in advance. You now know the big 5. Brief blindness in one eye, sudden one-sided numbness or tingling, abrupt loss of coordination or a drunk walk, sudden serious speech breakdown, and vitiligo combined with new, unusual headaches. Any of these showing up for the first time, even if they vanish in under a minute, is a reason to talk to a doctor urgently. And if it happens, you have a 72-hour window. The goal isn't to panic, it's to not waste that window. Stroke specialists point out how important it is not to be completely alone after a suspected transient attack. This is worth planning ahead with your family and your doctor, especially if you live by yourself. If a more serious episode happens and you suddenly can't speak or move, you need another person who can see it, call emergency services, and reach you quickly. Don't drive yourself after a possible TIA. Losing vision or arm control for even a few seconds at highway speed is life-threatening, for you and for everyone around you. If you or someone nearby can measure blood pressure and the top number is around 180 or higher, or the bottom number is around 110 or higher, that fits a hypertensive crisis, not just elevated pressure. Calling emergency services right away is what standard guidelines recommend. Ask your doctor in advance what threshold they want you to treat as an emergency. One rule from stroke medicine is absolute. Never start blood thinners, aspirin, anticoagulants, or similar medications on your own based on a friend's advice or something you read online. There are 2 types of stroke. Thinning the blood can help in certain ischemic situations, but in a hemorrhagic stroke, it can make the bleeding faster and larger, and that can kill someone more quickly. The only way to reliably tell the difference is with brain imaging, usually a CT scan at a hospital. While waiting for help or on the way to care, lying down is generally better than sitting bolt upright because it helps blood flow to the brain. Keep the head in a neutral position, not bent sharply forward, not thrown back. Avoid smoking, alcohol, or very hot showers in that moment. since sudden vessel dilation in an already unstable circulation can make things worse. Having a written list of all the medications you take regularly, kept somewhere easy to find, is a small step that can save precious minutes for emergency teams. And if 72 hours pass without a new episode, that doesn't mean you're in the clear. It means you were given a second chance. And you still need to use it. There are 3 evaluations worth asking your doctor about if you've had any of these warning signs. The first is a carotid duplex ultrasound, which shows both the anatomy of the artery and how blood is flowing through it, including whether flow speeds up and becomes turbulent at a narrowed segment. If the carotid artery is narrowed by more than about 70% by plaque, doctors call that a hemodynamically significant stenosis. At that point, the question shifts from will a stroke ever happen to when will it happen if nothing changes. The second is a blood test called glycated hemoglobin, or HbA1c. It reflects your average blood sugar over about 3 months, not just a single fasting snapshot. It's especially good at catching that gray zone called pre-diabetes, where sugar has been high enough long enough to damage vessels, but nobody has labeled it diabetes yet. Below 5.7% is normal. 5.7 to 6.4% is pre-diabetes. 6.5% or higher typically fits diabetes. The third is Holter ECG monitoring, a 24-hour heart rhythm recording. The reason is straightforward. Some dangerous rhythm problems come and go. They might show up once or twice a day for a few seconds and be completely missed by a short in-office ECG. The biggest rhythm culprit for stroke is atrial fibrillation. In AFib, the upper chambers of the heart stop beating in a steady, organized way and instead quiver chaotically, sometimes at 300 to 400 contractions per minute. Blood doesn't empty smoothly. It churns and swirls. And in that swirling blood, clots form very easily. Those clots can shoot up to the brain and lodge in an artery. Many people with atrial fibrillation don't feel dramatic symptoms. At most they notice occasional skipped beats or brief flutters, and they chalk it up to stress or caffeine. Holter monitoring is what catches these hidden episodes. And if AFib is found, there are well-studied anticoagulant medications that, when prescribed and monitored correctly, can cut the stroke risk in this condition by roughly 60 to 70%. That's not an inevitable outcome. That's a risk you and your cardiologist can actively work on. Everything covered here is for your understanding and education. It does not replace a medical consultation. Your situation is specific to you, and using this as a starting point for a real conversation with your doctor will always be more useful than trying to manage things on your own. If you recognized any of these 5 warning signs from your own life, even from months ago, write down in plain language what happened and bring that list to a doctor. Don't rely on memory. Ask directly whether you should be evaluated for TIAs and whether carotid ultrasound, glycated hemoglobin, or Holter monitoring makes sense in your case. If this video made a complicated topic easier to follow, subscribe and hit like. That's how this content reaches more people who need to hear it. And if you know someone with a history of high blood pressure, diabetes, or smoking, send them this video right now. It might be the most important thing you do today.